As an intensive care registrar, I'm often involved in medical emergencies or situations where the patient is in cardiac arrest. During these situations, it is my responsibility to make life-altering decisions about patient care. This includes determining the cause of deterioration, deciding on appropriate treatment, and assessing whether higher levels of care, such as intensive care, is appropriate for this patient. And I often have to do this under significant time pressure and for patients that I've never met before. This requires me to rapidly grasp the patient's medical condition, including baseline function and active current medical issues. My name is Sal. I'm a senior doctor that's training in both intensive care medicine as well as kidney medicine. And I made this channel to go through topics that I think are not taught well in medical school or in medical training, which I hope will help you in your medical career. In this video, I'll teach you my 5-step approach to reviewing a patient's notes in order to do this effectively and quickly. The first step when I'm given a patient's notes is to look for the ambulance printout sheet. The ambulance sheet will contain important information as to why the patient had phoned for help in the first place and other information such as patient observation as well as date of admission. The second step is to look for the initial Clarkin, normally done in the emergency department, acute medical unit, or the surgical assessment unit. This Clarkin is normally done by middle grade doctors such as the medicine trainees or senior house officers. In here, I'll be looking at the history of presenting complaint. I'll also be looking for the social history as well as the functional history of the patient. These two documents are important as they contain the most accurate documentation of why the patient is in hospital and are least prone to misinterpretation or Chinese whispers. The third step is to look for the admitting consultant review. It is here that you'll get a reliable medical impression and diagnosis, and it is here that the escalation status such as DNA CPR or ward level care might already have been decided and documented. For the fourth step, I'm going to skip everything in the middle and flip right to the back, looking for a medical entry with a clear list of medical issues. Usually, it will be a ward round entry done by a middle grade doctor and contains a list of current active medical issues. If there is a medical issue on the problem list that you need more detail on, for example, why this patient has an acute kidney injury, you can do the fifth and last step, which is to flip back and look for an entry that has more details on that specific medical issue. These 5 steps will give you enough information to make informed decisions quickly. You can practice these 5 steps next time you're asked to see a new patient, either during a ward round or other circumstances. And the more you practice this, the faster you will be. I hope that helps. The faster